All right, so Sarah, can you tell me your main complaints? Don't give me whole story. What's bothering you the most right now?
Fatigue and joint pain.
Fatigue and
Brain
joint
fog,
pain.
brain fog.
Brain fog. Okay, once hold on there and hold on there. And let's check for hand to hand. Now we see more and more these people have from 80 to 90 is considered normal, but we're beginning to see like 100 where electric charge, probably electromagnetic field played a role. And she's electrically charged. And let me wear my gloves. Michael, you're not blocking the view, are you?
By the way.
That's good now, yeah, thanks.
Yeah. All right, so so I'll be checking 40 acupuncture point to map out your energy pattern. The meridian system that has been known for 4,000 or 5,000 years, so it's not a new information. And let me check for your first meridian, lymphatic system of your tonsil. So normal range from 45 to 55. 50 is considered properly tuned, and your reading is at 52. It says normal acceptable range. High normal, it says fine. And this is a test point. I'm not really interested in this point. We're going to travel along the line to measure your dental point. And it says fine. Now we're going to your lung meridian. It says okay. Checking for your large intestine. It says okay. Checking for your central nervous system and peripheral nervous system, pericardium, and allergy point. That's allergy immunology point. Let's check for your allergy point for metal and fungal problem showing up as a problem. And check for another allergy point. That's a little bit better, but still way up. So 3 out of 3 allergy immunology point is out of balance. This is for cellular degeneration point. And triple warmer for hormonal point. Says okay. Check for adrenal. But it says adrenal reading is off. So although it says control point for hormone says fine, but no, her adrenal reading is out of balance. For female over 40 years old, I always check for this called this particular point for breast point. And that's a little bit off too. And I usually write it down because I only check for 40 points, but I write down there's something about your breast on the right side is a little bit off. And then checking for your heart meridian. Good. And checking for your small intestine. All right, so we're going to switch hand. Now we're going to measure left side, mirror image of your right side, and checking again for lymphatic system of your tonsil as a test point. Says okay. Checking for your dental point. So dental is showing up. When I pick up the left side, it can be left side or usually or low jaw is what you will see statistically about 80% of the time. So checking for your lung. And checking for your large intestine. Checking for your nervous system. And checking for your pericardium. Checking for your allergy point. And checking for your allergy point again for metal and fungus. It's off. And it's all off. So 6 out of 6 allergy point is out of balance. Your immune system has been compromised to a degree. And if I pick out like a pancreas or liver problem showing up, I would say as a part of the evaluation, we need to check for cancer profile. All right, let's go for your next point. Is a cellular degeneration point. And for your triple warm-up control point, it says fine, but let's check for your adrenal point. So when I see two adrenal point, both is low, these people usually complain about fatigue. So you never trust this one point alone. If somebody says fatigue, you always check for the extra point, like adrenal point. For female, I would check for hormonal point for the breast, and again is low normal. So this is something, it's not a bad thing to also look for like a thermal imaging for the breast for screening, because we know 1 out of 8 women develop cancer during our lifetime. And checking for your heart meridian. Low normal, and checking for your small intestine. And you know what, there's something skip. I have to watch the panel. One skip, so we're going back. Checking for your heart meridian and small intestine. All right, now we're going to go to your pancreas. Switch your hand, please. So let's look for your, may I have it? No, right, the other right. Give me the other right. Yeah. Yeah. All right, we'll check for your pancreas. Now, if somebody have a diabetes, I'll check all the extra point, but otherwise, I just move on to the next point, checking for your liver. This is a liver reading is off. And checking for your joint is off, and she was complaining about joint pain and fatigue. This is a stomach meridian, and that's connective tissue and going into skin. That's skin and fat metabolism. Gallbladder, now going into your kidney. Our kidney reading is off. So liver and kidney out of balance. And
Finally having some abnormals. I'm
yes,
worrying about being too normal for you.
yeah, bladder and
Poor bladder. Looks fine.
that's for your female organ system. For the uterus, it's fine. Let's go through your left foot, please. Switch into your other hand. And checking for spleen. And for your liver, it's off.
What was
Both liver on your left side,
Oh.
left lobe, yeah. And checking for your joint, yeah. And for stomach, and that's for your connective tissue. Your skin, and for your fat metabolism, and when I measure, I just measure it. I don't have any intention or attention, and certainly I don't have any compassion either. I just measure it, you know. That's your kidney. So something about the kidney. Actually, you mentioned about front tooth. That's probably running through your kidney meridian. Yeah. That's your bladder meridian. And for check for your uterus. It's low normal. It says fine. So let's just save these data. We're going to take a look at it. Okay, we're going to print them out. Let's put your foot down, please. And
Bad enough? Yeah. Okay. I was worried that it wasn't bad enough.
all right, so let's take a look at it from here. Can you see the screen? Oh, Barbara, I think we need to get a dental X-ray on it. Is there any way you can get a dental X-ray on it? Okay. What I need to do this, while we're going to going over your chart, I want you to get a dental X-ray right now. Okay. All right. So if you look at from here, it says right foot, written in German, right foot, left foot. I'm sorry. No. Right hand, left hand, right foot, left foot. Green means within normal range. And here's the allergy immunology point. I checked 3 points. They're all 3 out of 3 all low. This is how adrenal point is off. Also breast point was out of balance. This is a dental point, allergy immunology point. Triple warmer controlling the hormone is out of balance. Liver is out of balance. Joint, stomach, meridian, kidney, liver, again joint, stomach, meridian, connective tissue, and kidney showing up. She didn't complain about kidney problem. She just complained about joint pain and fatigue. But so we got here 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 out of 40 meridian is out of balance. I'm looking at this pattern in her history. Does this study match? So I have to keep asking her now, so you got joint pain and fatigue. Now tell me more. The dental will be, if I remember, she got root canal in front. I think some cavitation work done. Yeah. She's got 50 IV ozone therapy. So this is after the treatment. This is how her reading looks. So she's not still feeling well. Dental is not completed yet, incomplete. Her adrenal reading is low because it's a 3, it means a triple warmer there. Her immune system is compromised with her age group. I don't know exactly how old she is. With her liver being out of balance, both sides. I'll be thinking about she's a high risk for developing cancer. I'm just going by statistics. You know, so I'll be looking for, maybe we should look for cancer profile, not because you have a cancer, as a screening to look for is anything going on. Look for human chorionic gonadotropin, PHI for phosphohexoisomerase, CEA, it's just some basic screening tests. You can check for DHA.TSH. There's a developer, Dr. Chandler. I use his lab. It's just screening test. Are you high risk or low risk? That's all I'm checking. Can I reduce the risk? And sometimes like a PS is high, CA is high, PHI phosphohexoisomerase is high, and then go to the parasite cleansing, and all of a sudden the score goes down. It's like we are reducing the risk factor for developing cancer. So like, oh, that's cool, Before diagnose, you can do something about it as a preventive. So anyway, so they looking for the pattern, and she mentioned about joint pain. That I'll be looking, is that joint pain has anything to do with a dental problem right here? So I'll be doing checking and cross-checking is any relationship, except I can kind of sort things out, but I cannot fix the dental problem. I know statistically, because of the liver problem showing up, it will be high in my list. She may have some parasite problem, thinking about flukes. So I'll be jumping into praziquantel, maybe something else. But anyway, a stomach meridian, that could be from dental problem. It can be a H. pylori, bacterial, or protozoal infections. I'll be testing those combinations. And the stomach meridian goes right into your breast. So she got a little bit of a higher risk. All right? I see dental problem, kidney problem, and I see root canal in number 8 and 9. So this is what we'll do. Hold on here, please. Okay. Now we'll check for your dental point again. This time you look at this from here, it says 38. just confirming, double checking it. It might be a little bit different, but it's the same reading. Now give me your left foot, please. Yeah. And her kidney reading is also low. Now let's check for her liver also too. And stomach. And join again. Now I want you to touch these two fingers up there. Yeah, nice press down there. Now we're looking for the relationship. This is called cross-reference. Let's check for dental. Well, what we're looking for is the resonance phenomenon. Is there any relationship? Something about the dental at this point respond. Now let's check for, just for fun, kidney. Is there any influence on kidney? It's putting a stress on kidney. Now let's check for liver, okay? Maybe some, but it doesn't balance it out, okay? And let's check for stomach. It says no, there's no resonance to it. Now let's check for joint. It says a joint is balanced out to normal. So the tooth resonate to dental, kidney, and the joint.
Can you test for allergy immunology?
Sure, man.
Very good question.
Yeah. No.
How about breast?
No. Check for breast. No. So that's it's not same related with this tooth problem. So I know there's a relation with the root canal and the kidney. So what are the most common problem with the root canals and dental infection? They can cause a GI problem, joint problem, kidney problem, as a nephritis of some sort, and heart problem. But not heart because her wisdom tooth is not involved. At least it's not an active problem, but kidney and joint is involved. Any questions with that?
So those teeth aren't on any of the meridians.
Yeah.
So it wouldn't be. Is it possible that it could be a breast?
No,
Because
no,
none of
no.
the meridians. So
Yeah.
could it affect it?
No, we'll get into that part. Just relax now, there. Okay. So I'm just trying to solve the problem. You know, we have to thinking as a, for me, I have to think like an internist looking at the relationship. I think what he's saying is the causal chain. That's what he's talking about it, but I'm processing it right now. So let's see from here again. So you have a 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 out of 40 strings are out of tune. All right? After 50 IV ozone therapy and whatever therapy you went through. And I'm going to play the violin.
Okay.
Now, once you map out, now you can navigate yes and no. But you have to do quietly. But anyway, I'm going to listen to the sound. Just listen to the sound, the subtle difference in sound.
So you were asking questions.
Some like that. Some like that. I already have some idea. It just saved me time. Before I go through back and forth, it takes time. But now I just go through that. I already have an intuition feeling. But I'm double checking before I do anything else to save me time. So let's go for random here. Let's say parental palmoid, ivermectin, and praziquantel. That's what I use the most, right? So we'll put them on. And see what happened here. Have your left foot, please. So let's check. Yeah, let's check for liver. Okay. slight improvement, but no dramatic improvement. Check for stomach. No dramatic improvement there. So you know what I'll do is just say, I say screw it.
All right.
And let's say I'll put on some tinidazole, okay? And let's check for your liver. It looks better, but not what I want it to be yet. Then let's check for your stomach. Almost, but not quite. So I'm going to combine with the praziquantel in combination. I just know from the liver, respond very well to praziquantel. I don't want to miss it. So I'm adding tinidazole and praziquantel. So let's check for your liver. You balance it out. And for your stomach. Okay, so kind of balanced out. Oh, that's cool. And
How about my allergies? Did it balance my allergies?
I haven't got to the point yet.
Sorry.
Yeah. So. All right, what else we are doing here? Your connective tissue, yeah. Your connective tissue was off. No, that's a separate phenomenon. You may have to drink lots of water. You may have scars. You know, somewhere in your body have a scar. There's another one. Let's check for your kidney. Kidney is a mobile dental. It's not, you know, it's not a parasite problem. And now let's check for your allergy point, right? Yeah. No. So I'm going to give you some allergy support. I use Nesme and Pro-Alo is the main one I use. And some improvement, but not quite. So now what I'll do is let's check for, do you have heavy metals? I'm not going to tell you what's in there. That's a DMPS. Either you have a mercury or lead.
Both.
Yeah, yeah. And let's check for, this is another point, but that didn't respond to DMPS. I'll be thinking about now fungal problem. So are you having some, let's put on nystatin, see how your body responds. Some improvement, but not what I want it to be. And then let's check for whether they have a candida problem. Better, but not what I want it to be. What do you have? More like, where did that go?
Oranox?
Or this is
Yeah.
energy, it's electromagnetic spectrum and near
Well, let's say,
light, or
just hold on, yeah. You have a more related problem. Sporanox have a more activity for moles. Diflucan has more activity for candida problems. I'm thinking you have some more as a part of your problem. You may have also, and when I see that, I put on automatic mycotoxin inhibitor. And let's check for another allergy point. So now all 3 out of 3 point balanced out. So let's check for your adrenal. Remember your adrenal reading was low? Looks better. Let's check for your breast. Looks better. Well, that's good. And let's check for your dental just to double check. If you go through antifungal, antiparasitic, is that going to help you? No, it's not going to help you.
How about the liver? We're still off.
Was it? Did I check liver or not? Maybe I forgot to check liver.
With the antiparasitics.
Okay. Let's check for allergy point here again. We'll go back to the liver point. So allergy point looks better. Allergy point looks better. Now all those 6 out of 6 allergy point looks better. You're dealing with a heavy metal problem, and especially fungal problem, more like a mold kind of a fungal problem, like aspergillus type. You know. Now let's go for liver. Yeah, I forgot. Yeah. Yeah, give me your right foot, please. You don't have to change. Actually, reading does not change. Let's check for your liver, okay? You're right. Liver is, is not balancing it out. Yeah.
You put hepatic on?
Hmm?
Put hepatic on?
Oh, sure, ma'am.
Should be some drainage.
Getting crowded up there.
Yeah, I know.
She's been through a lot. There's just a little more to go, Sarah.
It's all good.
Upward and onward.
This is wonderful.
Isn't it crazy?
The left side looks improved, but the right side didn't change a bit.
How about my
So-
breast on the right? Did you,
Mm. Oh, yeah, you're right.
because you had
Just,
bilateral breast.
just hold on for a second,
Okay.
please. And don't look. That's your liver. Liver, and check for your joint. Joint is a dental problem. I cannot balance it out. And stomach meridian. Yeah, I can balance it out. And check for your kidney. Still the problem. It's a separate and independent problem. So what do you want to check? Put
You
your
said right breast.
Oh yeah.
You didn't
Okay.
make sure that one
Oh yeah,
balanced.
that's right. All right, let's check. It balances. Now we can reverse it. It balances. We'll take this
What did you just last?
albendazole. Let's see. Remove the albendazole and see what happened. There's no change there. Okay. So let's check for praziquantel. Still there's no change. And let's remove this one here. And so drops. That's tinidazole. These are protozoal infections. You know, it means, remember this aerobic, anaerobic metabolism, protozoa, metabolic, they're very similar to cancer and protozoa. I'm thinking maybe there's some risk for there. Just high risk. I don't want to scare patients and say, oh, you may have a cancer. I say, it's just higher risk factors. And if somebody's open, professional like that, might say, it may not be a bad thing to check for cancer profile. Just see, are you high risk or low risk? And do dermal breast imaging as a part of the evaluation. You see the logic behind how to process this? So you have to have understanding of the meridian system to see and interpret this pattern, what's going on. Yeah. And then eventually we'll all balance it after several visits, assuming she got the dental work done. And then we go through the provocation using contrast at a deeper level.
So would you start her on treatment first before you do the dental work?
I usually do, yeah, unless she have a pain. But the root canal patient don't have a pain, so usually silent infections. So, and it's like this. Another way to check is, so this is a dental problem. She got antifungal, or chelating it, but there's no response to it. So let's check this, amoxicillin. There's no resonance there. People with a streptococcal infection respond to amoxicillin, and they usually complain about pain. She doesn't have pain. So we're not dealing with streptococcal infections, at least not classical streptococcal infection. So let's check for doxycycline. She got some resonance. I'm thinking maybe she may have some spirochete infections. Let's take this one up. And checking for checking for what are you?
And I have a history
So are those
of
changing?
Babesia and protozoa.
So if you have a guitar string or violin string, those things are changing?
Yeah, just hold on. Yeah. That's clindamycin. Some improvement again. So we'll combine them, doxycycline and clindamycin. And so we're dealing with sort of anaerobic infection and spirochete infection. I just know from the pharmaceutical activity of the medication, we all are trained for those, so we know what it does, right? Now let's check for your kidney. Now she's not touching her tooth. Now we're going to just using the clindamycin and doxycycline and see how she responds to the kidney. Respond. It's just another cross-checking and check for her joint. It looks better. So let's say she's diagnosed with the arthritis or diagnosed now with the rheumatism, and people use minocycline as a treatment. They feel better, and they have to be on there for the rest of their lives. Or maybe put it down Tucson and see what happens. Yes? Makes sense?
Mhm.
Yeah.
How
Yeah.
do you start everything at once, or do you test with, what steps?
I always check for parasite first. That means more like a albendazole, tinidazole, and praziquantel. Usually,
Parasite
just
first.
I don't have to check, but just her body weight and whatever. I will do about 3 times a day for 21 days. Usually, I'll put on like a 30 days. But I go through the cerebral applied kinesiology, 3 times a day or 4 times a day, But usually in their range for most people. And then then come back, recheck. Then eventually the dental reading looks okay, and then all the rest of the point is okay except the dental. And then I say get the dental work to be done. So I'm very emphatic about the certain sequence to do it. Only reason I know because I made many mistakes.
When would you do the antifungal?
Oh, that one you can take it right now. I think what is a Spronax for, what did I say for, which meridian was it? The allergy point. Yeah, I'm sorry, yeah, the allergy point, yeah. So that one can be on any time really. She's so squeamish, so worried about it. I
I'm not worried.
I may do just parasite cleansing first, and then do fungal, and then do heavy metal tests, and then eventually will be a dental work to be done. And there will be some improvement up and down, yeah. So I think this approach, I think most medical doctors can understand because we understand medication and basic principles, so easier to explain. Now, naturopaths are approaching a very different way, and I'm saying, man, I don't know, I don't get it. When they do it, I feel like I'm dyslexic. I don't quite get it, what they're thinking, because I have a different background to coming from, I force myself to understand this, but I don't get it, but it's not a foolproof system, but people who are open to it respond very well. But if patients are skeptical, everything is questioning, then I become uneasy, and I only do one step at a time because she's so afraid, and guess what? They don't respond. So.
Would you, even though you do it together, would you maybe start one thing one day, the next thing the next day? Would you start it like that, or not necessarily? You just.
Oh, for me, I just put on that. Yeah. And if you have any side effects, don't call me. You have to tough it out. You're going to be my patient. You have to tough it out. So I say, compassion is a part of my strengths.
You were in the Marines?
No, just U.S. Army. That's all.
Now, you don't have the antiparasitics on your tray, but
Yeah.
you would treat with those anyway?
They were
Because earlier they didn't.
Yeah. So let's check for the liver. Let's check for the liver. Now there's no. I put the parasite medication out, right? So let's check for the liver.
It's not on.
It's not on. The parasite
Right,
medication is
yeah.
not on. So let's see what happened. It's off. Stomach meridian is off. Right?
I
But-
believe so.
But you go through back and forth many times, and I thought, it kind of makes sense.
Yep.
Yeah. Because I'm using medication, pharmaceutical company already did the homework for what kind of work, they do. So like even pick and choose antifungal medication. If it's a more GI problem, I'll be using maybe a nystatin. If it's more like a candida problem, it's systemic, may require diflucan, or you can add on a nystatin with it if you're going to especially put on antibiotic too. If it's more like a fungal as a more-like problem or candida more-like problem, I will use Spronox, because each one of it is a little bit different activity to it, And I will put on, usually when I put on antifungal, I will usually put on like a mycotoxin inhibitor as a part of it to protect them from getting too much, mycotoxin reaction to it. Maybe oregano oil, again. And then I just put on automatically some kidney support, liver support, allergy remedies, all those. I don't bother to check on them, just put on automatically. I'm not going to spend my time to go nitty-gritty. I got the main one I need to know, and that's it.